Hello, this is Dr. Kavya Malani for a Medical Wellness Lecture. Today I want to talk about the use of mammograms and breast cancer screening in general. Obviously, the most common cancer in the US is not breast cancer, but breast cancer ranks extremely high, and it is a significant cause of morbidity and of mortality among women. And there's every reason and every indication for patients, for the population, for policymakers, and for physicians to make sure that they can control and screen for breast cancer in advance. And definitely breast cancer does create a significant amount of stress and morbidity and mortality. Breast cancer is also very complicated in many ways, and I'll give some examples of how that's complicated right now. If, for example, most people think of breast cancer as a disease of 40 years olds and above, or 50-year-olds really and above. However, in my clinical practice and in many other doctor practices locally, people have been seen with breast cancer 30 years of age and up. And so it is not sufficient to basically delay investigating lesions or talking to patients about this issue, and for patients to have to basically then ignore breast cancer risks and screening until they feel they're at the right age. So one issue is that if you think there's a lesion there, if the shape of the breast changes, then definitely refer to the physicians and begin to have them investigate and look and see what is going on. However, the other thing that's very interesting is that there are a lot of social determinants also of health that affect breast cancer. One of them is the issue of actual racism. For example, if an African-American woman has been a victim of racism, or at workplace, for example, the risk for breast cancer goes up actually by 15%. So there are kind of really very significant and interesting issues surrounding breast cancer, and so it is not a simple thing. And even though I'll try to concisely put it all together, remember that the whole concept and the whole diagnosis and treatment is actually much more complicated. Breast cancer screening, per all the recommendations that are really available, needs to begin at the age of 40. Now, of course, people have been recommending for breast self-awareness, breast monthly self-exam, like basically after the periods, but nowadays the main way to examine the breast is the clinical breast exam by physician, and number two is the mammogram screening. MRIs have come and been tested, and they're not really cost effective, and sonogram is also not cost effective as a general screen for breast cancer. At this point, mammograms are the best methodology to look at breast cancer. The issue of mammograms is radiation, and that they are always kind of better and faster, or new techniques in mammography, like film versus digital film, or 3D mammography versus 2D mammography. They're always basically trying to push the technology forward, and despite the promises, these technological advances oftentimes do not deliver. I mean, it is not really very clear if digital mammography, for example, compared to classical mammography with film, does actually improve in outcomes like saving lives. But anyway, so as we stand at the moment in 2017, what I do recommend is that people get screened, and I like either the ACOG recommendations or the United States Preventive Task Force Services recommendations. They basically recommend screening from the age of 40 to 50, depending on the patient and doctor's consultation and advice. But after the age of 50, definitely every 2 years, a mammography has to be done, and that is in conjunction with a clinical breast exam by a provider, which would be a physician or a physician assistant or nurse practitioner. Then after that, really the major issue is that at what point you stop. And the current recommendation are kind of a little bit various, but 75 definitely people should stop screening for mammography. The other forms of testing, like the 3D testing, which insurance do not cover, and you have to pay some extra $50 to $75 out of pocket for that. I do not recommend that to my patients. I still think that that's experimental and not very useful as yet. but that may change in the next few years. So in general, start at the age of 40 to have discussions. At the age of 50, definitely the mammography to be taking place. I, in general, screen a few times from the age of 40 to 50 myself, like every 2 or 3 years, depending on risk. But the number you need to treat, meaning the number of people you have to actually do mammograms on to save a life, from 50 to 75 is about 500. So you do testing on 500 patients, basically you can save one life. From age of 40 to 50, basically the number you need to treat, the NNT, drops to about 2,000. So you do testing on 2,000 people, you can save one life. So testing is much less beneficial, much less effective, but regardless, it is out there. So with all this, in a nutshell, definitely talk about this at the age of 40 and above, and start screening at the age of 50 and above. And I think that we'll leave it at that. This is Dr. Kavian Milani for the Wellness Updates. Thank you.